I'm just going to mute.
Hello, everyone, and welcome. I'll just give us a few moments for people to get settled in. Hope everyone's having a great day. Okay, so I think I'll start us off. So hello, everyone, and welcome. My name is Caitlin Jaggers, and I'm the research lead at the Alzheimer's Society of Canada in the Research Knowledge Translation and Exchange team. The Alzheimer's Society of Canada is very pleased to welcome you to another ASRP Exchange presentation that is being offered through our provincial support program. This series has been developed to feature Alzheimer's Society research program recipients who have completed their funding and who will speak to the outcomes of their ASRP supported research while addressing how their results have and will continue to impact people with lived experience. Joining us today is Joanne Bracken from the Alzheimer's Society of Saskatchewan, who will assist in moderating the question and answer period following today's presentation. I would like to start off today's webinar by going through the agenda presented here, and then I will pass it over to Dr. Juanita-Dawne Bacsu. Before we begin, please note this webinar is estimated to be under 1 hour in length and is being recorded, but that only the video and audio of the presenters is captured during the recording. The presentation recording, in addition to the PowerPoint slides in PDF form, will be made available on Connection for Alzheimer's Society staff, as well as on the Alzheimer's Society of Canada website on our ASRP Exchange webpage following today's webinar. Today's webinar will be presented by Dr. Juanita-Dawne Bacsu and is being offered as one of the ASRP Exchange webinars within the provincial support program Meet the Researchers series. We are so pleased to have Juanita here with us today, to present her project, Dementia, Stigma, and Rural Aging. It is somewhat of a taboo topic. This project was funded by the Alzheimer's Society Research Program starting in September of 2018, with project completion ending in September of 2020. Dr. Juanita is a postdoctoral fellow working with the support of Dr. Megan O'Connell and the Rural Dementia Action Research team at the University of Saskatchewan. Her fellowship focuses on understanding the COVID-19 impact on people living with dementia. Last fall, she completed a postdoctoral fellowship focused on stigma of dementia in rural communities with the support of the Alzheimer's Society of Canada and Dr. Shanti Johnson, who is at the University of Alberta. Since 2009, Juanita has been a research associate with the Saskatchewan Population Health Evaluation Research Unit and a board member with the Canadian Rural Health Research Society. Prior to this, she was a senior communications manager for the provincial government in Saskatchewan and co-owned a family medicine clinic. Her research interests include dementia, cognitive health promotion, rural and remote health, age-friendly communities and environments, and health policy. At the end of today's presentation, Joanne Bracken will be moderating a short question and answer period. Please use the Zoom chat box feature if you have comments you would like to make or questions you would like to pose during the presentation. Please note we will hold off in asking our presenter to answer these questions until she has completed her presentation. Without further ado, please join me in welcoming Dr. Juanita-Dawne Bacsu.
So thanks for taking time to join me today. I'm just going to get my presentation up and going. So I'm delighted to have the opportunity to share some of my postdoctoral research on stigma of dementia in rural communities. I grew up in a small town in northeastern Saskatchewan called Tisdale, where I developed a real passion for working with rural older adults and people living with dementia. So here's an overview of my presentation today and some of the topics that I'll be covering. I'll provide a bit of background on dementia and stigma, discuss my postdoctoral research and my findings on ways to reduce stigma of dementia in rural communities, and then wrap up with some time for discussion and questions. So today I would like to begin my presentation with the real life story of Harold. Harold is a 70-year-old man who is a care partner for his wife on a farm. This one time, a while back, his wife got confused in the night and overdosed on pills. Harold is overwhelmed. He doesn't know what to do. He calls poison control. They say, if she overdid it, you need to slow her heartbeat. He reads them her pills and checks his wife's blood pressure. They tell him to recheck her blood pressure in the morning. He is hesitant to discuss his wife's cognitive health, and when asked, he quietly whispers, I think she has dementia. But I haven't told the kids. It's somewhat of a taboo topic. I finish up our interview, and as I leave, I notice a blood pressure cuff and the phone book on the kitchen table. I turn to Harold, but before I can speak, he responds, oh, that, just in case of emergencies. Now, Harold shared his story with me in an interview for my PhD research on rural cognitive health. And although dementia was not the study's focus, undertones of stigma were widespread. So what is dementia? Dementia is an overall term for a set of symptoms that are caused by disorders affecting the brain, ranging from Alzheimer's disease to Parkinson's. Often, when I present in rural areas, I share that dementia is like a vehicle brand, say like Ford, with different types of vehicles. So you have your F-150, your Ford Escape, your Ford Explorer, and your Ford Mustang. So really, dementia is just like a overall brand name or term for a range of conditions. We know that Alzheimer's disease is the most common type of dementia, as it accounts for roughly 64% of all dementia in Canada. Now, age is the greatest risk factor for developing dementia, and the number of rural older adults is rising in Canada. Recent studies also indicate that compared to urban older adults, rural older adults face a higher risk of dementia and other forms of cognitive impairment. However, rural communities often experience unique barriers with dementia care related to limited access to medical specialists such as geriatricians, neurologists, and psychiatrists, limited finances, public transportation, health services, and also the issue of stigma. So what is stigma? Stigma of dementia refers to any negative attitudes or discriminatory behaviors against people with dementia, just on the basis of having the disease. When a disease is common like dementia, but poorly understood, it's easy for myths and stigmatizing attitudes to spread and really reduce the quality of life for people living with dementia. So stigma includes having fixed ideas and judgments, such as thinking that people with dementia are not normal or not like us, or that they can simply get over their problems if they choose to, or ignoring people with dementia or treating them as inferior or invisible. In 2017, a national survey in Canada found that almost 50% of people would not want others to know if they were diagnosed with dementia. So why is stigma so important? Stigma of dementia can lead to social isolation, care partner burnout, depression, decreased quality of life, and delay an early dementia diagnosis. However, we know that an early dementia diagnosis enables people with dementia to acquire relevant information and support services, plan for the future, and access pharmaceutical treatments that may improve their quality of life. Currently, existing studies focus mainly on documenting stigma of dementia, but little is known on actions to reduce stigma. And so my research objectives were to identify ways to reduce stigma of dementia and improve the quality of life for people living with dementia, and also identify actions to improve knowledge, attitudes, and awareness of dementia in rural communities from the perspectives of rural older adults, including family members, friends, care partners, and people living with dementia and other types of cognitive impairment. Now, my study was guided by solutions-focused theory to embrace rural older adults' knowledge and their lived experiences. So solutions-focused theory focuses on asking questions rather than giving answers, capacity building in rural communities, investigating what works, and really identifying attainable action plans for moving forward. Now, using a community-based research approach, I developed a local advisory team where rural older adults provided local insight and suggestions throughout the study, from developing the research questions to identifying the dissemination strategies for sharing our findings. For my data collection, I conducted a scoping review, and I found very little research on actions to reduce stigma of dementia, and especially within a rural context. I also conducted semi-structured interviews with 18 rural older adults, including family members, friends, care partners, and people living with dementia and other forms of cognitive impairment. I also held a focus group with 7 community leaders, ages 60 plus, including representatives from local businesses, town council, and the senior center. The interviews and the focus group transcripts were analyzed using thematic analysis. Now, at the end of my study, we organized a community workshop to share insight and exchange study findings. So based on my interviews and focus groups with rural older adults, several actions were identified to reduce stigma and improve awareness of dementia. So here's a brief overview of 8 examples. Talk openly about dementia, one-on-one or in a group. Being open and talking about it would help everybody. I know it would help me because I'm worried I'm going to get it. Learn more about it. Learn ways to be supportive. This would disperse the fear of, I don't know what to say. Be a community leader or a champion to increase awareness and understanding of dementia. Share if you are experiencing dementia in the early stages. Sharing with someone or a group changes attitudes. Avoid hurtful language and jokes, and choose your words carefully. The way we speak can affect the way other people think and speak. We sometimes talk about dementia in a joking way, probably because of fear. That's what I do when I'm scared. I make a joke. People may get hurt by that and have hurt feelings, so you have to be careful. Be inclusive. Talk and socialize with people living with dementia. Don't shun, talk past, or ignore them. Pick them up, include them in things, and bring them to Coffee Row. Now, Coffee Row is a gathering where a lot of people come together at a community center or a senior center or a bakery or a coffee shop and join one another for coffee. I know it's kind of a cultural thing in rural Saskatchewan here. So when we present in the US, usually I got a lot of hands raised. What's Coffee Row? And the next is fundraising. At one time, breast cancer was at the same place where Alzheimer's is now, and it never really got discussed. Fundraising always brings things to the forefront. Intergenerational programs. We need to make it so our kids understand it. Someday I may get dementia and I want to know more about it and be treated the same way. So really making sure that different generations grow up with an understanding of dementia. And lastly, organize a workshop. Meet with seniors clubs and bring information forward. Have a physician or a spokesperson come and speak, someone who specializes in aging. So next steps. In moving forward, further research is necessary to explore interventions to improve public knowledge, attitudes, and awareness of dementia. In particular, my research was conducted in a small rural community in Saskatchewan, and more research is required to examine the generalizability of my findings to other geographical and cultural contexts, such as urban, rural, and remote communities. We know that there's a lot of heterogeneity there. And research is also needed to implement and test different types of actions on reducing stigma of dementia. So my journey forward and my career goals are to acquire a faculty position and secure funding to expand my anti-stigma research and evaluate different actions to reduce stigma against people living with dementia, especially within rural communities. And my long-term goals are really to build research capacity and community-based partnerships to continue to advance the quality of life for people living with dementia in rural communities. I would like to end my presentation today with a quote from Atal Gawande and from his book, Being Mortal. If you haven't read it, I highly recommend it. For me, this quote really speaks to the need to continue to work towards developing a better quality of life for people living with dementia. Better is possible. It does not take genius, it takes diligence, it takes moral clarity, it takes ingenuity, and above all, it takes a willingness to try. And I'd like to recognize and thank my supporters for my research, especially the Alzheimer's Society of Canada and the Alzheimer's Society of Saskatchewan for inviting me to share my research findings today. And lastly, I'd like to recognize my research team, since without their partnerships and collaboration, my research would not be possible. And I've included some great websites if you'd like to learn more about dementia. And so now I think we have a bit of time for group discussion and any questions. And I would love to hear the audience's thoughts today on maybe their ideas on best ways to share information on dementia in rural communities, and also about actions that they think would help to address stigma in rural areas. I'll end my screen here and we can open her up for questions. Oh, good. I got done in record time.
That was wonderful. Thank you, Juanita. I think that really shed light on an important topic that often doesn't get discussed, the rural community, especially in Saskatchewan. I think you really highlighted some key findings and some key ideas for moving forward. And I just want to highlight that story you shared at the beginning. I think that did an excellent job of framing the research that you decided to move forward with and learn more about. I think it really opened our eyes to that real life view and perspective on why it can be difficult to talk about dementia. And I think that story was just a really great way to begin your presentation. So I just wanted to share that. So yes, as mentioned, this is now the time to engage in a question and answer period. We invite audience members to use the chat box or question and answer box as well. And you can just enter your questions or comments there if you'd like to ask Juanita anything about today's presentation or her future research. And I guess in the meantime, Joanne, if you have anything that you'd like to ask Juanita while we wait for some questions from the audience.
Thanks, Caitlin. There is a comment here, just in response to what you spoke to earlier, Caitlin, about sharing stories can make it easier to talk about. And Juanita, I just wonder, in your research, you talked about storytelling. How comfortable were people with sharing their personal stories? And do you think that personal storytelling is a great way for us to diminish stigma and to encourage people to talk more openly about dementia?
I was very fortunate, actually, with my research. The communities that I had been working in, I was able to work with for several years prior, about 5 years prior. So we had established a strong level of trust within the communities. And so that's why I really chose these communities for this study, my postdoctoral work, because I believe that there's still so much stigma attached to dementia that it is a very difficult topic to address. I know a lot of my participants talked about how stigma of dementia reminds them of where stigma of mental health was about, a decade or so ago, and looking maybe towards mental health for some of our answers in moving forward and addressing stigma towards dementia. So one example that was highlighted is having celebrities really come forward and share their stories and storytelling related. And I know Jan Arden started doing a bit of this. And so I think that would also be a very useful way. And I heard a lot about that from the participants as well. Today was such a brief overview of the findings were so rich. Yeah.
Thank you. We have a question here. I work with seniors in rural BC. What is the best way for me to get educated about dementia and Alzheimer's? I heard about a great course and program with the University of Tasmania. Is there such a thing in Canada?
That's a fantastic question. I'd actually defer that to one of my Alzheimer's partners today about the educational aspects of about dementia. Like I always refer usually people in my rural communities to either the Alzheimer's Society of Canada's website to learn more, or else the Mayo Clinic also has a great website. I'm not sure in particular about courses. I know University of Toronto offered a course on dementia that I took, and it's open to community partners and members. And so that was a really great course, but I'm not sure if that's still being offered. Joanne or Caitlin, are you aware of any other programs or courses?
Yeah, I would just say if you're in BC, I would connect to the Alzheimer's Society of BC and to their programs and services. And the university the course at Tasmania, that's a massive online program, and it's open to anybody worldwide, and it is free of charge. So I mean, that is a great program. And as well, connecting to the Alzheimer's Society for additional programs would be where I would start. There's another question here, and it says, could that be You First or the Assant Cafe? So I think people, those are two other programs. So the Alzheimer's Society of Alberta has an online program and access to lots of online resources. I also know the Alzheimer's Society of Ontario also has that. And You First is an education and training program for healthcare professionals who work directly with people with dementia. So again, I think a good point of contact would be the Alzheimer's Society, and they could get you connected to the services across the country.
Great, thank you, Joan. Yeah, you said exactly what I was going to say in terms of referring to your local society for additional programs and services. So if there's any further questions in the chat box, Joanne, feel free to address those.
Just a comment here about the coffee row concept is amazing. I think I may try to incorporate that in a family health team atmosphere. And I know there's different programs, fireside chats, different ways to gather people to gain insight. So I think that's a great suggestion from people. Another question here. Are there plans to look into the Indigenous communities going forward for research?
Well, I think that's definitely a great topic and a great point. And I think that it really deserves its own study and its own, research there, because yeah, that's such an important area of research that needs to be addressed for sure, definitely.
I guess the question I would ask, and you did talk a little bit about this and some of the takeaways from the communities. You spoke earlier about there's such little research about, how do we end stigma? How do we move forward on that? So I'm just wondering about just any nuggets from perhaps people with dementia that you interviewed and their first person perspective on how we can reduce stigma.
For sure, definitely. So it was interesting because in small rural communities, usually everybody knows kind of, if something's experiencing, challenges or difficulties, but still there's so much stigma that it seems like people aren't comfortable sharing really still. And so I think that's why there was that suggestion about bringing in a physician or someone specialized in aging and dementia to come and speak about it, because we don't have that level of comfort in having people actually coming forward and sharing their stories. So although it would be recommended as an action, come forward and share your stories. You have to be at a place of comfort where you're able to do that. And so I think really just talking about it more, having more discussions about it, and just communication. That was, education and communication in the rural communities. Those were the two things I heard over and over again. We need more awareness. We need more communication and education. And then that will really allow those conversations to flow and that comfort level to kind of come through where people can start sharing their stories. Just having a safe place, I guess, to share your experiences.
Thank you. Another question. Do you have thoughts on cultural differences associated with dementia stigma and comfort level with in-home care and family dynamics?
I think the area is absolutely fascinating, the cultural differences and looking at stigma. And so that's why one of the areas that I believe requires further research is to look at different cultures and different geographical areas and how stigma impacts dementia within these communities. Like I said, my study just focused on one, little rural community in Saskatchewan. And so, yeah, I think that there's so much there with the cultural aspects. My background's ethnography. And so I think that's a huge important point for further research. Did I miss the second part of the question, Joanne?
Well, it was just sort of in the context of cultural differences and their comfort level with in-home care and just the different family dynamics as well.
I'm not sure if the differences in comfort level with in-home care, if that's really a difference in culture as much as a difference in services provided within the community. I feel like if there were those services offered and available within the community, people would make use of them, but often it's a time of, it's difficult to access those services in some of the communities because the services just aren't really available. And so I'm not sure if it's so much a cultural difference as much as it is more of a accessibility and availability of services difference. And also the cost. Sometimes services can cost a lot to bring. If you want a housekeeper to come in or you need someone to help you out with yard work, there's also financial constraints there too as well that we heard about. And so that can really kind of impact people's ability to age in place.
One of the other things that you mentioned earlier in your presentation is around limited access to specialists. So did participants talk about barriers with access to specialists? And I'm also wondering, does that also complicate the ability to get a diagnosis when you live in rural areas of our province?
Definitely, that was a major thing. A point that came up was not having access to specialists. And most people that I met with never did receive a diagnosis. And a lot of people too just even questioned kind of what's the point of driving into the city and trying to organize that trip into the city to receive the diagnosis, because the financial resources, the transportation, all those aspects that it would take and the costs to get into the city and then kind of navigate the city. It seems you're right. You really touched on an important point that came up a lot, is just that barrier to access with healthcare specialists and services. And we do offer actually kind of remote services within the province, but a lot of people are unaware of those options. I know at the Rural Dementia Action Research Team, they're really working towards, improving technological access for, seniors living in rural and remote communities. But just that level of awareness we need to increase, that services are available.
Great. Another question here. Can you describe examples of multi-generational activities outside of family circles in rural communities?
Multi-generational activities. So some of the multi-generational activities that were shared with me during my interview were there was a pen pal program created with the school and with older adults living in a different rural community. And so that was one of the ideas. And so if we kind of develop that as a starting base, like maybe a pen pal program, or there were so many different intergenerational ideas, or like a cafe, kind of invite younger generations to Coffee Row. just to have that communication as a starting place. And then if there were educational workshops in the community, don't limit it just to older adults, include all people. As we know, dementia doesn't just affect older adults, it can affect any age group. And so just opening it up, opening that discussion up.
Great, thank you. What is the most appropriate way to respond when someone shares their experiences with dementia? I often find myself at a loss for words.
Definitely, and that's something that came up too. And so in one of the themes that we highlighted, learn more about it, a lot of people said, I don't know what to say, I don't know how to approach it, but that almost made it more difficult, because then we had people living with dementia telling us stories. They'd see their friends on the street, and after they found out about the diagnosis, they'd turn the other way and trying to just avoid them and ignore them and kind of walk past them. And so I think that's really an important piece, is learning how to communicate and really just being careful with your choice of words. I think that's the most important thing. Don't ignore, don't avoid or shun, but choose your words carefully and just yeah.
Great advice, Juanita. Another question here, wondering about, did you include early onset dementia?
Definitely, the study was opened up to any person. In fact, we even went beyond that and included people with other forms of cognitive impairment. So if you had a brain injury too, we didn't want to limit it. We wanted I wanted to make the study as inclusive as possible.
Excellent. And just another comment here in regards to helping to reduce some of the stigma is dementia-friendly communities is a great initiative to reduce stigma and build awareness. And again, lots of Alzheimer's societies across Canada are involved in building resources and supports around the dementia-friendly community initiative.
Yeah, that's a great point. Actually, that was one of the questions that I received at the end of the study from the community, or what are some of the things that we can do to make our rural area more dementia inclusive? And so, no, I think that's very important.
And I would just say, if there's participants who want to learn more about dementia-friendly communities, to reach out to your local Alzheimer's society. And many Alzheimer's societies have initiatives to help people to understand the steps to build a more dementia-inclusive society. So I have another question. Do you think that the diagnosis is really important in helping to eliminate stigma?
I think that diagnosis is very important personally, on a personal level, especially if we can have a timely diagnosis and an early diagnosis. I think it allows you to kind of, find resources and supportive services that are out there that can help you talk about it. And support groups, especially, are very important when you first receive the diagnosis. And so, no, for sure, I think that's a huge, important point.
I was just wondering if you could speak a bit more about pursuing research during the pandemic, during COVID-19. I know that was something I had mentioned in the introduction prior to your presentation, that this is something you've been focusing on. And I was just wondering if you had any advice to other researchers about pursuing research during the pandemic.
For sure. So actually, I'm just starting a really interesting study right now where I'm working with a large team across Canada. I can't take all the credit here, with the CCNA group. And we're looking at Twitter to examine stigma and ageism towards people living with dementia. And the data sets there are just incredible. I know we just finished a study using Twitter data to understand the COVID-19 experiences of people living with dementia. And I believe there was 6,053 relevant tweets that we analyzed in our data analysis. And so that's a really kind of interesting area that we're looking at right now, is just that whole kind of Twitter aspect for accessing information and studying.
Great, thank you.
I've got another question here. Did you find, for people still working, are you finding it difficult? Sorry, there's one just above here. Did you find stigmas more gender-based? For example, more men living with dementia feel more stigmatized?
I didn't find any specific gender aspects. It seemed across the board there was just a lot of stigma still occurring on both sides for both men and women, and so nothing related to gender really stood out there. It seemed like there was, there's so much room for more education and awareness. Really, I think that's just so key, is just that increasing knowledge will really help to improve attitudes.
And another question. So this is about people who are still working. Do you find for people still working, are they finding it difficult to share their diagnosis with their employer due to fear?
Oh, that's a great question. Actually, in my study sample, the sample was mostly people who were retired, and so I didn't really come across that, but that would be, a very important area to look into.
Okay, Joanne, if we're not seeing any new comments come through or questions, what I'd like to do is just thank Juanita one more time for an incredible presentation, and really, as I mentioned previously, shedding light on something that's not often discussed, which is stigma itself, and really learning more about what it means to get a diagnosis of dementia, or just if you're questioning that you have dementia or that a loved one is living with dementia. It's just breaking down a lot of those barriers and really increasing the education. I think you did a great job providing more context to that and showing why it is so important. And I'd just like to introduce Dr. Vanessa Taylor, who will be our next ASRP Exchange webinar presenter, and she will be presenting on Wednesday, June 30th at 12 p.m. EST. And Dr. Vanessa Taylor is a Quality of Life Grant recipient, and she is studying semantics in people with mild cognitive impairment and Alzheimer's disease, and is focusing on the development of a short screening tool for this area of study. So if you're interested in registering for Dr. Taylor's presentation, the link is provided below and will also be circulated through social media. And just going back quickly, if you know of anyone who'd like to access this presentation following the webinar after it's closed, you can do so through Connection if you're an Alzheimer's Society member of staff. And if you are from the public, you can use the Alzheimer's Society website, and the video recording will be accessible there to share or view yourself if there's anything you'd like to watch again. And I think if there's no other questions or comments, I will conclude our presentation here a little bit early. And thank you everyone for attending, and hopefully you found this to be an educational experience for you. I know I certainly did, and learned a lot. So thank you both to Juanita and Joanne for shedding light on this important topic. And I think we can all leave today with additional information and a better understanding of why these conversations are important. So I'll just stop sharing. And thank you everyone, and I hope you have a wonderful rest of the day.